Hi guys, Tara Scott from Revitalize. So I wanted to make a few videos about the gut. So it seems like as a provider, when you have a personal experience, that makes you want to learn more about it and be more experienced to treat it, to help people so they don't have to go through what you did. So last year, actually really for a lot of my life, I've had gut issues, but last year I did find out that I had a parasite infection. So we've been seeing a ton of GI patients at Revitalize, and it's not the typical patient that would come to us, but it seems like everything starts in the gut. So we're definitely skilled on treating these patients. So today I want to talk about digestion, because if we go through the gut, we have to start from the top down. So we're going to talk about digestion today. So the first thing that you need to have to digest your food is to chew. Did you know you actually have to chew your food 30 times each bite? When you chew, you break up food into small pieces, and enzymes are released in your mouth as well. So I know my son eats a whole slice of pizza in about 3 bites. So I'm constantly telling him, chew your food, so it can be broken down. If you don't chew your food when it reaches the stomach, it's not going to be in a small enough particle for your body to recognize. And that's one of the things that can prompt an immune response. But there are other things that affect poor digestion. Now, a lot of people have heartburn. And so I know I took a ton of H2 blockers like Pepcid and Zantac, and also PPIs or proton pump inhibitors like Prilosec. And so the H2 blockers actually work at the receptor and block the acid from working in your stomach. And the PPIs, protein pump inhibitors, are actually preventing the pump that releases the acid. It doesn't prevent your body from making it. So it makes it very hard for you to get off of it, because when you take the PPI, it's like a big wall there. And then as soon as you stop taking it, all that acid has built up because your body's still making it, and then people feel terrible. And if you look at the package insert, those drugs are only indicated for 6 weeks of use for a temporary condition. So not having the right amount of acid and blocking the acid in your stomach can impair your digestion. Stomach acid actually decreases as you get older. But how many people as they get older are put on these PPIs or H2 blockers? A lot of our patients. Not eating enough fiber can also affect your digestion. And so I know what we call the SAD diet, or the standard American diet, can affect your digestion. And also changes in your microbiome, or the balance of your bacteria, which can be affected by antibiotics and also poor dietary choices, so processed food. So all of these things are things that can affect your digestion. So I know when we do a stool test, there's actually a complete digestive stool analysis that actually measures your pancreatic enzymes. It measures the products of the breakdown in your stool to see if you have enough stomach acid. So with this stool test, we are better able to advise patients what to do. And the good news is, part of it is dietary changes, but part of it is just supplements, not necessarily a medication, and not anything that you would have to take for a long time. So if you're suffering from not digesting your food, or maybe you see pieces of food in your stool, you may need to get your digestion checked with a stool test.